Once a year, Cleveland Clinic gathers 100 physicians and researchers from 20 different countries to review over 150 innovative technologies and ultimately to select the top 10 medical innovations that will change the way healthcare is delivered. In this week's Money Talk Think segment, Dr. Vipan Nikore, who is the Chief Medical Officer at TD Bank Group, takes us through the list and explains why each one is so important. You've got the top 10 medical innovations list that's put together by the Cleveland Clinic. Before we get there, you want to start with a little background. This is a good list.
Yeah, it's a great list, and it's vetted by a really experienced group of innovators and medical and health professionals down in Cleveland at Cleveland Clinic. It's a rigorous process that these innovations go through. They narrow it down to 10 every year, and over the years, pretty much every single one except, I believe, one has made it to clinical practice. So.
Okay, so this is a reliable list in terms of votes.
Generally.
Let's bring it up up on the screen so everyone can take a look at it. There's a look at your top 10. And a lot of very technical medical terms on that. So we're going to go through each one, but what we asked you to do is find 3 that you think are probably the more interesting to you in terms of what's happening next year. So let's start with the one you focused on. This is a dual-acting osteoporosis drug, which I would think of as huge interest to women.
Of course. And I had to pick the winner, number 1 on the list, and it really is going to have a big impact. So osteoporosis is a process when you have low bone density, typically affects women, postmenopausal women, and worldwide this is something that affects over 200 million people. This one here works on sort of both mechanisms where it helps build up the bone and helps prevent breakdown the bone. And when you compared this drug, it's called romosozumab, when you compare that drug to alendronate, which is sort of the standard bisphosphonate, it showed a 50% reduction in spine fractures and 38% reduction in hip fractures.
Interesting. Let's go to the next one on, I should say the next on the list, number 3 on the list actually that you, again, you're going to highlight. This is inaugural treatment for, here we go, transthyretin amyloid cardiomyopathy.
Amyloid is a process, a disease process where you have these small protein fibrils and they deposit throughout various parts of your body, such as the heart. And what we actually have found is that this one entity, amyloid TTR, one subset of it, typically has not had any treatment. And there's now a new treatment called tafamidis, and it's really been a game changer because you've gone from a disease process where you've had no treatment to something that can really improve outcomes by 30%.
The other one here that you wanted to focus on as well was something around closed loop spinal cord stimulation. So again, who would benefit from something like this?
Sure, so these are typically people who have intractable back pain or lower extremity pain, but now we have this closed loop system where it can provide feedback based on the amount of basically the amount of stimulation that you need. It can read that based on your movement and other body factors and provide that. So before you would have a remote control you have to carry around and you can try to adjust it as necessary, and now we actually have this system.
Okay, let's go back to the list again, and there's a few others that we want to just get, if we could briefly, just to translate.
Yes.
So expanded use of this is minimally invasive mitral valve surgery, and I was reading a bit, this is about a valve close to the heart?
Yes,
the problems?
yes.
Yeah.
So we have 4 valves in our heart. One of them is the mitral valve. And typically when we have to repair a valve, we would have to do open heart surgery. So we go in, break the chest open, take out and put in a new valve. And in 2013, there was an approval to do basically catheter-based replacement of valves. So they could replace this mitral valve, but only for people who couldn't tolerate the open heart surgery. The reason this made the list, and it's a little bit US-centric, is that the FDA approved this procedure for people who are in a broader category, not just those who couldn't tolerate the procedure. So now that's a bit of a game changer for those patients.
Oh, interesting. Number 4 on this list is also interesting, therapy for peanut allergies.
Yes.
And so what's happening with this?
Yeah, so peanut allergies, we know that this is something that's affecting a lot of children, and it's becoming much more and more common. Now we have a pill that people can take, monitored of course, and you slowly increase the tolerance, the amount that you give to a child. They build up tolerance. There's a small amount of peanut that's in there. It's a little bit controversial because there's been a little you can actually get anaphylaxis by
with
taking the pill.
treatment.
Yeah, so there's a little bit of controversy, but the potential for this is obviously something that's very interesting. So.
The other one, number 6 on the list, biologics and orthopedic repair.
This is really a treatment that supplements orthopedic surgeons. So they go in, they repair various parts, such as a torn ACL. Now they put this little sort of sponge across the ACL. They use medicines called biologics, and they combine that with your own sort of plasma factors, the patient's own factors, and that promotes healing. So that could be used maybe in rotator cuff and other areas as well.
Every athlete just perked up.
Absolutely.
Antibiotic envelopes for cardiac implantable devices.
We implant many pacemakers and defibrillators. There's a small chance that they can get infected. This newer technology allows for basically an antibiotic to be released in an envelope, which sort of dissolves on its own over a week time, and it's shown a 40% decrease in the chance of infections. That's actually been around for a while, but there were some newer studies that showed that it's actually working, and now it's being used a little more, particularly in higher risk patients.
Interesting. Okay, this one I'm not going to say right. Bempedoic acid for cholesterol lowering in statin intolerant patients. This is people with cholesterol that can't use statins, is that right?
Yes, so bempedoic acid, cholesterol obviously affects many people across the world. It's a huge issue. Statins are wonderful medicines. About 5 to 10% of people can have myalgias or muscle pain, so they can't tolerate it. Now we have a medicine that showed that there's a 25% reduction in cholesterol using this medicine. So
PARP inhibitors, and I'm going to jump to ovarian cancer. So,
yes.
So is this a change in a treatment for ovarian cancer?
Yeah, so it's more in the prevention of reoccurrence. So there's treatments for ovarian cancer. Now we have a therapy that people can take, and it shows a 70% reduction in the recurrence of ovarian cancer.
Last one, this is to do with a heart failure drug with something called preserved ejection fraction. So
yes.
What does that mean in English?
Sure, and this as an internist is something I see every day, all the time. So there's congestive heart failure, very common reason for hospitalizations and for people just generally as people get older. Typically there's 2 parts, either you don't pump as well or it doesn't relax as well. We've typically had many medications for helping when it doesn't pump as well, but not much for when it doesn't relax as well. And what's interesting here is this was actually a diabetic drug, SGLT2 inhibitors. You pee out the glucose, excess glucose for diabetics, and then serendipitously it's found that it actually helps, it looks like it's helping people with preserved ejection fraction. So very interesting.
Fascinating list. Thank you very much.
Thank you for having me.